morning. My name is Ayman Eissa. I'm an independent practitioner. I work as a consultant anaesthetist and in pain medicine for over 20 years. Medical cannabis is a relatively new concept in the UK. I believe that it will have a big impact on a proportion part of the society who are already using medical cannabis for different indications, including pain. And I think it will have a role in different aspects of pain management and even part of a solution for a big problem in the pain medicine, which we call it the opioid crisis. Integro is one of the first medical groups who become specialized in medical cannabis. Their approach is very much complying with the national and international standard for medical cannabis. I found that they strongly believe in the multidisciplinary concept of dealing with medical cannabis and the patient who needs it. So that made me attracted to the high standard of Integro. I'm relatively new to Integro, but I was fortunate to link with Integro as a medical group and get a lot of experience, support, and acceptance. And I am building personally my experience, and I found it a good start for me to start with a well-established group like Integro. Interestingly, when I started to be exposed to the concept of medical cannabis, I was a skeptic about the whole thing, as many clinicians were. And gradually I started to read and engage in debates and attending meetings and lectures, and gradually I start to understand more about the science behind medical cannabis, and gradually I started to shift from skepticism. So now I believe that medical cannabis does and will have a big role in dealing with chronic pain patients. If we look at medical cannabis as not just a simple painkiller or another strong painkiller, which we now believe that this is not the answer for our chronic pain patient, but it does have effect on the quality of life of this patient, stress level, sleep, appetite, mood. So from this, if we look at it this way, cannabis is relatively unique in dealing with all this aspect of a chronic pain patient. The beauty of medical cannabis is that it is very much not a very addictive drug if you compare it with any other strong painkiller that we use, to the extent that I believe it can play a big role in the opioid crisis that we are dealing with, and it is a hugely challenging problem in chronic pain world. I believe that medical cannabis can have a strong and effective opioid sparing effect, which will help us to wean our patients who are on a strong painkiller, which we know that they are causing more harm than good to these patients.